morning, good afternoon, good evening to all. Today, 1st April 2023, IFP's 943rd day of our Zoom meeting. We are approaching to the 1,000 days of our Zoom meeting, continuous Zoom meeting, uninterrupted Zoom meeting for the last and 943rd day. So I welcome all of you from different parts of the world. Now today, our guest is Dr. Sreenivasan M.D, Homeopathy. Let us have a 1-minute silent prayer for this successful program and for Dr. Sreenivasan M.D. Let us have 1-minute silent prayer. Thank you all. Now we know that several times he visited our platform and he did wonderful classes for us. Dr. Sreenivasan M.D, Homeopathy, visiting professor, Shivaraj Homeopathic Medical College, Salem. M.D. taken from Sonajiro Shirsagar Homeopathic Medical College, Beat, Maharashtra. Speaker in various conferences in Canada and India, Chennai and Salem. So in Shivaraj Homeopathic Medical College, Salem, and above all, 22 years experience. Today, the subject is the follow-up. That is an important thing because when we are doing a prescription, after that, how to go, what is the way, how to develop our ways, what is the development of the diseases, and what to do in future. Prognosis, we should know the prognosis of the disease. After that, we have to do a practice plan for the next treatment pattern. So Dr. Sreenivasan, doctor, you are welcome to our platform and you are a great person. We had your experiences several times and today, now for the 45 minutes will be your talk and after that, there will be a discussion part. So you are welcome, doctor. You are most welcome to our platform. You, doctor, please unmute yourself and talk.
Yes, sir. Thank you very much. So you can share this card I have sent to all the participants. And
you can send it to, is it your card?
No, I shall send it to you, Dr. Hibbert.
Okay. Thank you very much.
Sure, sir. And the card can be printed, laminated, and framed, kept on the table of our friends, and they can use it as a quick reference. One Dr. Veerabhadra Rao, who was an ENT surgeon and professor in Andhra Government Medical College in ENT department. He became a homeopath and did his MO from London. And he was a great, very systematic practitioner. Myself and a lot of my friends went to his clinic in Eluru, Andhra Pradesh. We learned with him for several years. We used to go there periodically. And he taught very minute things in practice that is a real great help in solving several difficult cases. One great thing I found with him was he is very critical in assessing what is happening to the patient after a prescription. Many of my friends I saw and many colleagues and many doctors whom I met, they are very good in giving the first remedy. The first prescription was really great. And the first prescription makes changes in the individual, and that change could be anything. As Dr. Boger says in his synoptic key foreword, we can never exactly predict what will happen after our first dose. The first dose coming in contact with an individual can produce n number of possible changes. And Dr. Veerabhadra Rao will accurately evaluate, judge what is happening in the patient after first prescription. On that basis, analysis, evaluation, he will decide what to do next. This is from Hahnemann, Herring, Bjorninghosen, Kent, Vitolkas, Dr. Rajan, any master for that matter. They made a systematic critical evaluation as to what is happening in the patient. Good, bad, stand still, what to do, how to intervene. So I think that is a great help in my practice, and I thought I will express this to my friends and junior colleagues, and that will help them also. And one of the great advantage I had is discussing my experiences and learnings with colleagues and friends in workshops which we conduct in different parts of Tamil Nadu. The team is a very small team. We sit one to one or a small group, and we start reading one book cover to cover. The foreword, the introduction, other feedbacks from other doctors, the contents of the book, the construction of the book, how to use the book. This we do theoretically with one book. Say, for example, it could be Boger Synoptic Key, it could be Boger Boninghosen Characteristic Repertory, or it could be No-Sode Repertory, whatever it is. We read the rubrics, we understand, and stage 2, we take live cases, discuss the case directly, apply the rubric, give the medicine, come back and see whether our learning and application is correct or it requires changes and refinement. This way, we improve upon one method, and usually this goes on for 1.5 years or 2 years. So we become much better in applying one method. From these colleagues who work with me in workshops, rather I learned a lot. And one of the learning is we made a schema. Maybe this is there in all our masters existing textbooks already. Kent, Vitolkas, Hahnemann, Boninghosen, they all did this. We put it in a simple format for ready usage in our clinic. And we made a chart after that. And on top of the chart, I gave what are the, like we do in our school, no, in our chemistry lab, what are the basic requirements to conduct an experiment, requisites, then how to conduct the experiment. And third step is what is the outcome of the experiment. And fourth one is inference, what you have learned from the experiment result and what to do further. Exactly similar model. This chart we made for using 50 millismol potency dispensed in water, not a direct pill dose, but dispensed in water. A single dose is divided into 15 doses or 20 doses in water. Patient takes it once daily, twice daily, thrice daily, or once in 2 days, once in 3 days, like that, depending on the case and the various other factors. And after giving the dose, what happens to the patient in a given case at the given instance, and how to understand that, what step we have to take. So we made a chart of this for practical application. We keep it in our table, and when patient comes for follow-up especially, we just make an evaluation of what is happening to the patient and see in the chart where it is present. That is on the lower half. I gave a small list of things. I'll read out for our viewers. I'll read one by one. And this applies not only to LM potency, this applies to our centesimal scale potencies also, whether we give in single dose or whether we give in water, dispensed in water and taken as divided dose in water. Okay. The most common possibilities are amelioration, no change at all, aggravation, production of new symptoms, patient undergoes proving smoothly or violently, old symptoms coming back, palliation, suppression, an acute situation coming up. Some patients are hypersensitive, external peripheral symptoms remain. So the most common possibilities. So I am not trying to mimic Kent's 12 observation. We just made a small list what commonly occurs and observed in practice, how to differentiate each point. Then we make a decision on whether to wait, increase the potency, increase the dosage, increase the frequency, decrease the potency, decrease the dosage, decrease the frequency, whether it requires an antidoting, whether to give an acute remedy. Sometimes we have to switch to potencies, like we give LM potency, we may have to go for centesimal potency or sometimes even decimal CX potencies also, or whether we have to go for olfaction than oral ingestion. Other possibility is external application of the homeopathic remedy in potency or change of treatment plan. So these are common solutions available in follow-up. And we have to decide after evaluation what is happening to the patient, what is our choice further. Okay. So I'll say again, after giving a remedy, there are multiple possibilities. The most common possibility I observed in practice is amelioration of symptoms, no change at all, aggravation of symptoms, new symptoms cropping up, patient starts to prove the remedy, old symptoms coming back, palliation, suppression of symptoms, an acute situation where the patient is taking treatment for chronic disease, patient is hypersensitive, proving all the drug, all the potencies, all the minutest dosage, what to do. And after giving treatment, all the constitutional symptoms disappeared, all the generalities improved, but external or peripheral symptoms are still remaining, what to do. So these are most common things that happens in our practice, and we make a judgment of what is happening in the patient. Then we go for what to do next. So I just want to say the minute differences in each point. One is amelioration. Amelioration is broadly, I understand, as three types of amelioration. One is the symptoms for which patient came becomes less. Number two, generalities also improve at physical and mental level. Number three, the pathology regress and the test report also begins to reduce or becoming better. So amelioration broadly three categories: symptomatic relief, or the symptoms for which patient came begins to decrease in intensity frequency and relapses. Secondly, physical and mental generals improving. Third one, the pathology and test reports also begin to regress. When all these three things happen, we call it homeopathic amelioration. So let us understand this point very carefully because we have to differentiate between an overall amelioration in a homeopathic way and palliation or suppression. So ideally speaking, after homeopathic remedy, if these three things happen, it is really good and we call it as homeopathic amelioration. Number one, relief in the symptoms for which patient came, improvement in generalities and physical and mental generals, and third point is changes in pathologies. A tumor is there, it started reducing in size. The pain has subsided, tumor size also reduced. Good. And investigation reports also begin to show positive changes. So these three criteria to understand that it is a homeopathic amelioration and overall improvement, that is what is desired after our dosage. And second possibility is after our homeopathic potency. Here I want to emphasize on one point, the difference between potency and dosage. Potency is, say for example, 30, 200, 1M, 10M, 50M, or LM1, LM2, LM3, LM4, LM5, LM6, or in decimal scale 3x, 6x, 12x, 24x. So these are potencies. The dosage is 1 pill, 2 pill, 3 pill, 5 pill, or if dissolved in water, given 2 ml, 5 ml, 10 ml. That is dosage. And frequency is once daily, twice daily, thrice daily, once in 2 days, once in 3 days, or once in every hour, once in 2 hours. That is frequency. So these basics needs clear grasp so that we travel in same plane. Okay, potency, dosage, and frequency. So there are some patients, some circumstances, some disease where whatever potency is used, all the three scales, there will be no change. There are some patients, some circumstances where no amount of dosage helps. There are some circumstances where no amount of frequency helps. So either of one criteria, two or all the three may not produce any change whatsoever in the patient due to various reasons. And depends on the patient, depends on the idiosyncrasy, depends on the disease stage. One has to sit, find out what is actual cause for that. And depending on that, we have to make further decision what to do. Okay, that is possibility number two. Possibility number three is an aggravation. The aggravations are very commonly homeopathic aggravation, disease aggravation, medicinal aggravation. The homeopathic aggravation, it is a desirable factor where we are very sure the remedy is acting, it is accurate and it is curative. But it is preferable that the homeopathic aggravation is gentle and patient is able to endure the slightest aggravation. The medicinal aggravation is accessory extra symptoms, and the disease aggravation is in spite of our best effort, the disease symptoms continue to progress in intensity, frequency, and duration. So, three types of aggravations: homeopathic aggravation, where symptoms are slightly more, but the patient feels the energy levels are better, the generals are better, and gradually the aggravated present symptoms will also begin to decline. But if the aggravated symptoms are intense, it definitely requires antidoting. And second aggravation possible is the disease aggravation, where the disease continue to progress, increase in intensity, frequency, and the extent. And third is medicinal aggravation, where more symptoms of the medicine is present. If we refer the repertory or materia medica of that drug, we will find these symptoms, which also, if intense, requires antidoting. If it is mild, skipping the remedy, reducing the dosage itself will suffice. And fourth possibility is when new symptoms crop up. Patient will say, doctor, these things were not there. Now I am getting these symptoms. Very commonly, these are symptoms which very commonly, not always, very commonly, patient has forgotten that these symptoms are also present. They tend to forget because of the chronicity of symptoms, they become used to it, or because of the unsuitable medications, irrespective of the system, these symptoms are beclouded, and after the remedy, these symptoms crop up, comes to the surface. These symptoms usually goes off by dose adjustment. If they are troublesome, this also requires antidoting. And another common possibility with new symptom is patient maybe they are proving the drug which requires dose adjustment. So we have to write down these things. And with these points, when I ask my patients to write down the complaint by themselves, the advantage is even if patient has forgotten, when I show the record written by themselves, they realize that these are there already. So that way, asking the patient to write down their complaints in a record note and coming to the clinic has helped me a great deal. So you also suggest to your patients to write down their complaints and come and maintain that record. That saves our time, energy, and space, as well as patient can look back into the record and come with better understanding of the disease and the progress with the treatment. Fifth one, with LM potency, patient will go into provings very, very smoothly, imperceptibly, because when many symptoms become less and less and less, and their energy levels improve, they tend to bear the medicinal symptoms. They are undergoing the proving of the remedy. This is possible. So when using LM potency, I think this applies to our centesimal potency also. They may undergo proving of the remedy they are taking. Slowly, gently, mildly, these medicinal symptoms keep coming up. And the solution under such circumstances, just discontinue the dosage. That is the advantage of LM potency in liquid. By merely stopping the remedy for a day or two, these things will go off and it will be too gentle, and the results come very quickly. So be watchful that patient develop proving symptoms. If the symptoms are intense and if you're using centesimal potency, it definitely require antidoting of the existing intense symptom complex. And the next possibility is old symptoms cropping up. Here, it requires a little bit extra working with the patient, asking them to differentiate whether it is old symptom, new symptom, or proving symptoms. Many patients in practice, they have forgotten a lot of things, and it requires 1, 2, 3 sittings. We are treating chronic cases. It requires encouraging the patient. And one more thing, what I do is I request them to wait in the waiting hall. And in the meantime, I see other patients. And then these patients come back in their turn and say, yes, now I remember, doctor. After waiting for 10, 15 minutes, and they have their notebook in the hand, they used to come back and say, yes, now I remember I had these symptoms in the past. And old symptoms cropping up, we need to be extremely skeptical that the present symptoms gradually subsided, physical and mental generals improving, pathology regressing, and old symptoms coming up. Then it is a good sign. Otherwise, we have to carefully see whether it is unusual stirring up of the system and patient is becoming bad. So this one point we should look very carefully, not superficially. And it is also desired that even if old symptoms come, if it comes gently and patient is able to tolerate, then it is good. Otherwise, violent aggravation of old symptoms coming back, even though the present symptoms disappeared, generals improved, pathology regressed, old symptoms coming with violence, we have to adjust the dose. If it is LM potency and liquid dispensing, discontinue immediately, wait for a day or two, or if symptoms are very intense, take the local totality which become intense an antidote. And it usually indicate a different remedy, not the same remedy. Next possibility is palliation. Here I request earnestly all my homeopathic colleagues, don't predict prognosis when the patient comes for first consultation. Many cases I read in literature, masters have cured several cases which are diagnosed as end stage, whatever may be the disease name, of chronic nature, very violent nature, very bad prognosis. So say very commonly we know stage 4 cancer, if patient come to us, we immediately think I should palliate the patient. I think we should not approach any case at any stage with a palliative idea. We should always begin the case, always, with best possible cure in the case, as rapidly, as gently, as long as possible. So we never know which case will go for cure and which case will go for palliation. So we should not begin to treat any case at any stage with a palliative idea. So the idea of prognosis, even though it was told by Kent or any greatest master, let us progress one step better. I am telling with a humble request, not as that I am something more than Kent. There are several greatest homeopaths, even today, who admit that there are cases where they could only palliate in spite of their best effort. They don't begin the treatment with the idea of palliating, but during the progress of the case, patients respond only to a palliative extent. So we all should begin any case at any stage with the idea of, with an option of, with a possibility of curing the case. And then patient status will decide whether they progress for palliation or cure. Okay. So palliation is one possibility which happens in the due course of time. But the homeopath's motto should always be in all treatable cases, at all treatable stages, to cure the case. Okay. And next is suppression. Homeopathic remedies will also cause suppression very, very, very smoothly and imperceptibly. I think we should be more watchful. The patient, one very commonest thing I have seen, most commonest is patient comes with coryza. I take a local totality beautifully, refer the book, give the medicine, and the coryza stops within 1 hour. But next day patient comes and says, I am having cough. So this happens with homeopathic remedies also. So let us be very, very careful that homeopathic remedies will also produce suppression. A mouth ulcer, we give a remedy. If patient becomes better, after a day or two, patient comes with very violent burning in stomach, very intolerable pain, then we have done something wrong, mischief, suppression. So there We have to take altered totality, give the indicated remedy, and see that this symptom goes off. And sometimes the old symptom comes again, and then that also disappears, usually with same remedy, and patient is better. So let us be more skeptical that homeopathic remedies will also produce suppression. We should quickly intervene. Patient coming with coryza, I gave a remedy. Coryza stopped. In 2 days, patient gets wheezing. Then my remedy is suppressive and it is wrong. I should immediately intervene and the asthma should go, the wheezing should go, the coryza should come back, and then patient is better. And one more thing, if patient is having a dry cough, very dry cough, there is no rattle in the chest. I gave a remedy and the dry cough now become productive and patient is spitting out a lot of sputum. We think it is a discharge. No, this is a case where the remedy has neither acted or it has produced suppression. And dry cough become a rattling cough and there is lot of productive uh, cough. It is wrong. So we should also understand which discharge is correct, which discharge is wrong. A patient having severe stomach pain and menses for 1 day or 2 days, and after giving a remedy, there is profuse menses for 7 days, 8 days, and the abdominal pain is there or slightly reduced. It is again a wrong discharge. So every discharge should be accompanied by very strong improvement in all the symptoms, improvement in energy levels, improvement in pathology. Then only the discharge is right discharge. Otherwise, we must be skeptical to analyze whether the discharge is a sign of deterioration. So we must be careful about which discharge is good, which discharge is bad, and also homeopathic remedies can also produce suppression. We should identify where one symptom, one symptom disappear, a new symptom appear in the same system or some other organ system. We must be careful, quickly intervene, antidote with suitable indicated remedy, and save the patient. And next possibility is we are treating a patient with a very severe chronic disease. Say, for example, patient is having diabetes and put the patient on suitable indicated homeopathic remedy and patient comes with an acute fever and fever is with characteristics. The differentiation is energy level is low, very strong characteristic comes up with acute symptoms. And the first thing I do is to check whether the acute totality is also covered by same remedy. If yes, maybe a change of potency scale. Say for example, if patient I am treating with Calcarea LM3 and patient comes with an acute situation where it is still Calcarea, I usually give a centesimal scale potency, then patient become all right, and then the chronic remedy begins to work and switch back to same scale. Or if the acute totality is very strong with the location, sensation, modality, and concomitant, and clearly indicating another remedy, I give that another remedy that removes the acute symptom. Then I watch now whether this acute remedy is indicated as a chronic remedy or the old chronic remedy is coming back. There are instances where the acute remedy continue to act in chronic cases, chronic situations, or there are cases where the again old chronic remedy indications comes back that is useful, or after an acute remedy, a totally new chronic totality comes up, which requires a totally new chronic remedy. So this is three common possibilities. Number one, the acute remedy works as chronic remedy also, or after the acute remedy's action is over, the old chronic situation comes back using same old chronic medicine, or a totally new symptom picture comes about chronic disease, which indicate a new chronic remedy. So these are three common possibility in a chronic disease presenting with acute symptom totality. there are individuals who are very, very hypersensitive. I have so far I came across only one patient in all my years of practice. Any medicine, any potency, any dosage, he will go into proving. I tried rubbing, I tried olfaction, and all these also produce hypersensitivity. And somehow I lost track of that patient. I don't know what has happened to him. There are various suggestions when hypersensitive patients or patients throwing up hypersensitive reaction. They say switch potency, try minimum dose, try olfaction, try rubbing on the skin. These things I tried in this patient. Even I looked for which food item is aggravating. That also we could not identify specifically. So that is one possibility. But when that possibility is there, the common suggestion is you switch potency, reduce the dosage, reduce the frequency, try olfaction, try rubbing on the skin, all these things. These are possible. And if the hypersensitive reaction is life threatening, some doctors, to save their life, they suggest to go to an allopathic doctor and try antihistamines. Sometimes, if it is still needed, to try low dose steroids, which will bring down the hypersensitive reaction. Then patient respond well to our homeopathic remedy. And literature says some remedy suggestions. Try remedy sepia, try some Quecurium, try hepar, China, when patient is hypersensitive. I read in literature, but I never had the opportunity of trying it in practice. And external and peripheral symptoms remain. This is a greatest challenge. And convincing the patient and relatives is still bigger a challenge. Patient comes with hypertension, diabetes, and a very huge thyroid swelling, all these things. And after our remedy, all these things will go. But a small white patch on the skin still remains, or a small eczematous patch still remains, which is very resistant. And patient is not convinced at all that even though the sugar levels become normal, BPs become normal, thyroid become normal, and patients are off allopathic medicines, the still the cosmetic peripheral symptom, or maybe a lipoma still remains, or still a wart still remains which doesn't go, or a black nail color doesn't change. Like that, peripheral symptoms remain. This is a real practical challenge. And what Hahnemann recommend is the application of the indicated homeopathic remedy over the external peripheral symptom. Say if what is there, the internal remedy is thuja. When all the internal symptoms disappeared, patient is better in all aspects. Then you may try using thuja dispensed in aqua to apply over the external skin symptom, and then this also will go off. And his recommendation is to do it this way so that we are not prematurely deceived that when the external symptom disappear, internal symptom still remains and grows up, and patient become bad in future. So he says first treat internally, and if still external peripheral symptom remain, use the same remedy which has helped in curing the internal disease for external application also. So this is in chronic situations. In acute situations, for example, patient has burns or injuries, whether to use mother tinctures, yes, or cleaning the wound in a chronic case, yes, these can be used. And I had very little experience with external or peripheral remains. So that area, I still recommend, yes, it can be used. And in small number of cases where I used it, it worked wonderfully. But at the end of the treatment, not at the beginning. Or say, for example, vitiligo, shall I start a mother tincture in the beginning itself externally and give some remedy internally? I have not done like that, so I cannot comment. I cannot comment on such factors. So what I did is treat internally. I have not tried any specific in vitiligo as external mother tincture. And many of the patients, they responded really well to internal medicine. Those who did not get result, before I try anything externally, they discontinued the treatment and they went off. So I never had just an example in vitiligo, I'm telling. Other cases also, I had very little experience in chronic cases where all the other symptoms disappeared, a small amount of externals remain. What to do? As Hahnemann recommends, try the same remedy there and that goes. Yes, I tried it, it works. So, to do options are, as I said, when there is no change, what to do? We can wait or increase the potency, increase the dosage, increase the frequency. So, this is a probability column like we do in mathematics in our school. What is the probability when this and that is present? So, we gave a probability tabular column and we have to just see, say for example, when there is homeopathic amelioration, when there is homeopathic amelioration, what are the choices I have in the chart? Either you can wait or you can increase the potency, dosage, frequency. This is an advantage with LM potency and dispensed in liquid, aqua. Dry doses has a small disadvantage. Liquid dose has greater advantage in dose adjustment, frequency and quantity. Or even we can decrease the potency, dosage and frequency. Hahnemann mentioned use of decreasing potencies. We most common practice we all do is, say for example, we start the case with 30, we go to 200, 1M, 10M, 50M, or LM1, 2, 3, 4, 5, 6. In ascending order is the most commonest practice. Hahnemann mentioned descending order usage also. Say for example, if he starts so the case with 30 potency, he will even go to 24, he will go to 12, he will go to 6 also. This Hahnemann mentioned, but it has not gained momentum. And in his later editions of Organon, even in 6th edition Organon, he has totally stopped the usage of or mentioning the usage of descending scale of potency. Dr. R.E. Dudgeon, in his book, he has mentioned the usage of descending scale of potency. He gives a reasoning for that also, and he practiced usually descending scale potency. One Dr. Vaishali in Bangalore, she has also mentioned good success in acute cases. Say, for example, she gives one dose of pulsatilla 200 and patient is still better. She will give pulsatilla 31 dose that speeds up the result and the depth of the result is also very good. The chance of relapse rate is very less. So this Hahnemann also mentions, but I have not applied it directly. My practice is largely to increase the potency and go to next level scales. And that is very, very smooth with LM scale potencies, LM1, 2, 3, 4, 5, 6. Then jumping. We can also give LM3 to start with, LM6 to start with, and jump from LM3 to LM6 also, provided we are very, very seasoned, very, very sharp, and we are very responsible. We can jump potencies. Otherwise, it is gentler and smooth to travel from 1, 2, 3, 4, 5, 6. Okay. And then here, when patient is having an amelioration, we need not antidote, we need not use acutes, we need not go for C potency, we need not go for olfaction, we need not use it externally, and we need not change the treatment plan. So these are common possibility and probabilities. And you can see the chart, column 4 and column 3, and take a printout of this in a thick card, laminate, and keep it on your table, and also give me a feedback whether you are able to apply this in your practice and what difficulties you had and whether this has helped you improve your success rate. Give me a feedback and interact with me to apply it better and see whether I can help you much more.
Thank you, doctor.
Yes, sir. No questions,
Mhm.
please.
Yeah, someone raised their hands, and it was a very wonderful and nice presentation, even though the master, our master said, Ken's lectures we have read, and in Materia Medica we can see that several times there are using of palliation and everything. This time you are made your own views to give an advice for all the doctors to request us. That is great. I think that it is a genuine one. You are selecting such suggestions and requests. Thank you, doctor. But I think that that is the great thing. If it is a scientific way of thinking, that time we have to change, even though it is a long practicing data or things and practicing things. Thank you, doctor. Now, Dr. Veena Ganesh want to ask you something. Doctor, please,
Sure.
Veena, unmute. Yeah, you can ask.
Till she comes online, sir. One Mr. Ellis Barker in England, he was a non-medical doctor, non-medical person, trained under John Henry Clark. He used to go to Royal London Hospital, cancer ward. Stage 4 cancer patients diagnosed by Royal London Hospital allopathy doctors who are supposed to live for 1 week, 10 days, 20 days. Ellis Barker will kidnap these patients, change their diet, give homeopathy medicine, made these patients live for 7 years, 5 years, 10 years, 20 years. Ellis Barker, a non-medical person, stage 4 cancer, made them live for 5 years, 7 years, 10 years, 15 years. He has written a wonderful book. So when it is possible for a non-medical person, why not for us who are graduates? So we should attempt to cure patients than to start with the idea of palliation. Okay, sir. Questions?
And now, Dr. Veena, yeah, you can do it.
Yeah, sir, good evening, sir. Dr. Sreenivasan, sir, I was
Yes.
your student 25 years back. So
Okay.
we had a lecture on the same topic from your end in the second year.
Okay.
So it's been improved a lot and it has developed a lot of depth in your lecture. And I'm very grateful to you that we had a session at that time also and today also. Thank you so
Thank you.
much, sir.
Thank you.
I would request you to give the link or PDF or the PPT for reference to stick in our desktop so that we can enhance it.
Sure.
Please
I
send it to
request
Dr.
the
Dr.
sure.
Ganesh or circulate in the IFPH WhatsApp group so that it is available for us. Thank you so much,
Definitely.
sir. We are
Thank you.
very grateful for this wonderful session, sir.
Thank you.
Now, Dr. Manas.
Thank you, Dr.
Some
Yes.
sounds are, some noises are coming from, I think.
It is from our honorable guest that there is some problem with audio, I think. Anyway, I was listening very eagerly and with some curiosity. Very nice presentation because these kind of fundamental presentations are rare in our not only in IFPH but all other, because of the lack of the majority of homeopathy physicians are often interested in getting some sort of clues, what to do for this condition, what to do for that condition. That's also right. But this is also very important. We must know that there are a few terms that were totally used or only used by homeopathists. because the cure, recovery, palliation, suppression, the characteristic symptoms and the common symptoms, where all these terms are especially used by homeopathic doctors. And regarding this palliation, I think it was described in Ken's lectures. There is only one law, no special laws for palliation. We just give the similar remedy. But depending upon the case and the pathology, you may have to adjust the potency, the dosage, and in some cases, have to change the medicine. You can give some medicines, not at all a deeper action. You give some vegetable medicine in some cases, that is only difference. Then another thing is the potency selection, the back course. That's the word used by Dana. Back course should be taken. There is a logic. What is that? When you prescribe a medicine for a patient, your prescription often depends upon the characteristic symptoms. When you gave a remedy, naturally, when the patient comes the second time or after a couple of minutes or hours, the intensity of that characteristic symptoms will be much lesser. So quite naturally, we have to go back. That is the brilliance of Samuel Hahnemann. But unfortunately, we never recognize. That is the problem with us. So anyway, it's a very nice presentation. This is a scientific homeopathy, and this should be studied, learned, and practiced in each and every moment in your mind. Very wonderful presentation. Congratulations, doctor. Thank you.
Thank you, sir.
Anybody want to add or ask
Dr.
questions?
Veer,
Please raise your hands. Please raise your hand if you have anything to ask.
Dr.
Let me,
Veena,
let me add one point more important. In aphorism 157, there is an important statement or sentence added by Hahnemann. Aggravation of his own disease. What is that? Aphorism 157. That is the homeopathy aggravation. Because some characteristic symptoms will aggravate. That is the core, the nucleus of this aphorism or this area. The aggravations of the medicinal aggravation, the remedy reaction. It is the most important point. Aggravation of his own disease. Thank you.
thank you, sir.
Thank you, doctor. Now I want to ask you one question.
Yes, sir.
How can we find out if it is a medicinal aggravation or disease aggravation, and how can we differentiate it within? I think that the easy possible ways.
Yes, sir. The homeopathic aggravation, where patient's energy level is better, generalities improve, and the present characteristic symptoms alone is little intense. That is homeopathic aggravation. In medicinal aggravation, these two things are not there. The energy level improvement and generalities improvement is not there. Only the disease characteristic symptoms are slightly intensified. Third thing, disease is progressing. The disease symptoms are worse, energy level is less, generalities are less, the laboratory parameters are also worse. It is exact opposite of homeopathic aggravation. I
So I
clarified,
think,
sir?
sir,
It is clear, but
the answer is given in the aphorism 230. Dr. Hubert, you please refer that. I think that's the most important thing.
I ask you
Because-
because
Yes,
there are so many. There are after severe medications in some cases. There are after some severe medications from allopathic school and everything. That time we can. I think that sometime we may feel some difficulty. That is why I asked you.
Yes, definitely, sir. It's a difficulty. we have to, yes, it's a difficulty. And usually what happens, say very common example, if patient with hypertension, they are taking allopathic medicines, they come with a masked symptom image. The characteristics are generally not there because that is being reduced, subdued, taken control by the allopathic medicine itself. That is what usually happens. Correct? Do you agree with me, sir?
Yeah.
In that case, if patient is able to cooperate, I request them to reduce the allopathic medicine dosage. If that produce characteristic symptom, by reducing the allopathic dosage, if it produce characteristic symptom, I take that totality, prescribe on that. Then we can see whether it is producing a homeopathic cure or standstill or disease symptom comes out completely. That is one thing. Suppose a fresh case, we'll see another thing. A fresh case, first time diagnosed by us that the BP is very high. Patient is not taking allopathy, fresh case. If our remedy is curative, it will slightly intensify the present characteristic accompanied by improvement in generals and energy level and test level. If it is opposite, the present symptom is also more, generals are worse, BP recording is worse, that means disease progress. It is exact opposite, sir. Correct?
Thank you, doctor. Thank you, doctor. Because most of the cases are renal complaints are there. In such conditions, we may feel very difficult.
Very difficult. Yes, it is very difficult, provided they are treated with allopathic medicine and for a longer period. There, the image is masked. But with our remedy, three things very commonly happen. Even if there is slight intensification of symptom, there is general improvement, physical improvement, and accompanied by test report amelioration also at all three levels. So we are very sure we are in right track. Yes, we must be very careful. Yes.
Thank you, sir. Dr. Veena Ganesh, please say a word of thanks for our guest and your teacher. You unmute, yeah. Unmute. Yeah.
Sir, a detailed class on potency and repetition of dosage and the follow-up. We are very grateful, doctor, and personally, I thank you, and also on behalf of the Ifph members, I thank you for this wonderful session, and I equally thank the audience who have participated in this session. Thank you, sir. I'm so proud that you are my teacher. Thank you, sir.
Thank you so much. So, Dr. Danesh and other organizers, please feel easy to share this chart with all IFPH members, and whoever finds it useful, they can make a printout of it, laminate and keep on the table. And what is more important for me is whether it was useful for you, and if you have any trouble using it, feel easy to communicate to me in WhatsApp, and you can share my WhatsApp number also, so that I learn more. So it is a selfish motto. I learn more. Thank you so much.
Thank you, sir. Now we are ending here, concluding our session for 943rd day with a great teacher with us. Thank you, Dr. Sreenivasan. You are welcome always to our platform. Thank you, doctor. Your services is great. Now I invite Dr. Ashok Kumar for the Malayalam session, in our Malayalam session, our local language. And goodbye to all for tomorrow. This time we will have the next meeting. Hope you all engage in our meetings. Thank you all. Thank you all. Please,
Thank
Dr.
you.
Ashok
Thank
Kumar.
you, Dr. Hubert.